I am Dr. Noël Natoli, board-certified plastic surgeon and partner in New York Plastic Surgical Group. I specialize in female reconstruction. This includes rejuvenation, so mommy makeovers, and labiaplasties, as well as breast reconstruction. I also specialize in gender-affirming top surgery, body contouring, breast reconstruction. When I was first exposed to plastic surgery, I absolutely loved everything about it, although I never thought initially I was going to be a surgeon. And then as I gained more experience in it, I thought it was something that I could do. It wasn't common for a woman back then. I feel like I had a very natural connection with these patients and was able to realize the vision that they were looking for themselves, whether it be a breast reconstruction or a mommy makeover or just a slightly tweaked, better version of themselves. So there are very many sensitive topics in plastic surgery, and especially where I focused. These are areas that women feel vulnerable, and these women are often turning the lights off before intimate moments because they're concerned if they're going to be judged by their appearance of their genitalia. And so it's so important for me that I convey a sense of warmth and relatability to my patients so that they feel comfortable confiding in me. I always say, especially with my labiaplasty patients, it's so few and far between. The patient that actually makes the phone call and comes into the office is more than 90% of the time going to book the procedure, because we do make them feel comfortable, and I'm quite proud of that. And I think it's really that initial getting over the idea of discussing this with a real stranger. So I take my time to make sure that the patient, feels comfortable with me. I sit down with them and have a long talk about what their concerns are, what makes them feel the most vulnerable, and how we can, change things and help improve upon it. I think the biggest misconception sometimes patients have about plastic surgery, maybe not even patients, just people in general, is that you can see reels and Instagram and TikTok videos and they want to jump on the bandwagon without any really knowledge of their specific medical conditions or why or why not they may be a good candidate for that particular procedure. So it's really, the onus is on me as an expert in the field to talk to patients about it and not necessarily shy them away from a procedure, but say, well, I could see why that looks very enticing, but this isn't probably right for you. And maybe something that we can offer you instead is something that may be similar but a little different, or why they're absolutely appropriate for it and why I think it's going to take them to the next level and realize what they're looking for. Something that I'm especially proud of in my career is the variety of what I do. There's a lot of things we get taught that about 60% of what you do in your specialty is not what you were trained with. We weren't doing top surgeries and gender-affirming surgery when I was training, but it's something that I incorporated with my knowledge and expertise in the breast arena. I am very proud of the fact that I'm able to incorporate new things and offer patients what's cutting edge and coming up based on the knowledge that I already have. A piece of advice that really every patient needs to know, and this is going to sound a little cliche, but you really have to trust the process. These are not overnight results, and in the world of social media we live in, it's very easy for patients to think that the transformation is going to be immediate. Things happen like swelling and bruising and just things settling down in general. And so I do spend a lot of time with my patients counseling them on what they can expect and what the typical post-op period would be, or even for a minor procedure. And they really need to trust in that process and not expect these overnight immediate results. I'm seeing patients at this point in our Manhattan location, our Westchester location in Harrison, as well as several sites on Long Island.